a series of these, and this is the third in our series focused on better health and social responsibility. And we've got some colleagues here and we'll do some introductions before we get going. So Mags, if you can just share with people the agenda for today, please. So today, as well as a quick introduction, what we want to do is share with you some stories of impact on the theme of better health within our social responsibility and civic engagement plan. And there's a few colleagues I'd just like to make themselves known and say hello. So first of all, Rachel Lindley is a GP and senior clinical lecturer. Rachel's worked at the university almost as long as me, for 19 years, and she's taken a co-lead role on service learning. So Rachel, if you can just say hello.
Hello, everybody. Good afternoon.
Thanks very much, Rachel. We've also then got a student of Rachel's, Jasmine Rotary, who's a third-year medical student based in Preston at the moment, and Jasmine is going to be presenting alongside Rachel. So Jasmine, if you can say hello as well.
A really good afternoon to you all. So as Julian mentioned, my name is Jasmine Rotary and I am a third-year medical student here at Manchester, currently on my clinical placements over in Preston.
Thanks, Jasmine. And then can I also ask in a moment Professor Stephanie Snow to make herself known. Stephanie is a historian of medicine and healthcare, and she leads on the NHS at 70 and the COVID project, which is a major NHS program that she'll talk about in a moment. So Stephanie, if you can make yourself known.
Hello, everybody. It's really good to be with you today, and we're looking forward to sharing with you what we've been doing over the past 5 years.
Thank you, Stephanie. And we've also got a volunteer, Jane Hampson, who's worked on the NHS at 70 and the NHS Voices of COVID project. So Jane, if you can say hello to everyone.
Hi, I know it says Lucy, but I'm not Lucy, I'm Jane, and I don't know how to change it. So thank you for having me.
Hello, Lucy Jane. And then Dr. House Williams, House has a background in biology and molecular biology, and she's worked in clinical trials before becoming the manager in the university's Faculty of Biology, Medicine and Health in our Centre for Involvement and Engagement. So House.
Good afternoon, everyone.
Thank you very much, House. And last, but by certainly no means least, is Mags Bradbury, who's the Head of Social Responsibility and Civic Engagement at the university. Before joining the university, Mags worked in the NHS and she also worked in the co-op.
Hi, everyone.
Thank you very much, Mags. So then, that's the welcome. If we can just move to the next slide, please, Mags. Thanks. Just to remind colleagues, before we share these three stories with you, the university, as I'm sure you're aware, this is what we call, as you know, colloquially, our onion. We have three core goals: research and discovery, teaching and learning, and social responsibility. In the middle of this, because it's so essential to the university, is our people and our values. But around the outside are three interrelating themes: innovation, global influence, and civic engagement. And what you can see in the bottom right slide there is the plan we have for civic engagement and social responsibility, built around these 5 core priorities, one of which is better health we're talking about today. So next slide, please, Mags. So 5 different priorities. As you know, we've done a session on social inclusion. We've done one on prosperous communities. Today is on better health. And we will be also sharing sessions on cultural engagement and environmental sustainability. And they're the 5 key areas of focus for us. Next slide, please. Where do we do this work? Well, it starts on campus, where some people are sat today, where Nancy is, on the Oxford Road corridor, where we have a partnership with the hospitals and with the other universities. Obviously, we're based in the city of Manchester, and I noticed Bev Craig was dipped in. I don't know if she's still here. Is the leader of Manchester City Council. We're based in Greater Manchester with nearly 3 million people, 10 local authorities, with Andy Burnham as the mayor of that region. There's the Northwest, there's national, there's global, and actually we could put even into outer space. We do look at the origins of the universe out at Jodrell Bank. So actually our reach is at every conceivable level in physics, you might argue. So social responsibility and civic engagement. Civic engagement to us means what we're doing to make Greater Manchester a better place to live, work, grow old, grow up, grow healthy. And that's the focus of our civic engagement work. Next slide, Mags. So I'm just going to pass over to Mags, who's going to say a little bit about the Greater Manchester context before we share with you our 3 case studies. Mags.
And this is helping us set the scene for today, because for many of you, and I know there's people on the call that are absolute experts in this, what COVID has highlighted is some of the real health inequalities across Greater Manchester. I had the privilege to work in the NHS during the COVID crisis, and actually kind of one of the real positives out of that is this greater focus on actually health and public health and health inequalities. Sadly, Greater Manchester has a very sad tale to tell around COVID, because the mortality rate was higher. And we know that this is down to deprivation and factors around life, which are really limiting. We're working very closely with Greater Manchester Combined Authority through the Civic University Board and the agreement that we've made with the 5 universities. And one of the key things is this inequality across Greater Manchester. We see even within health that the life expectancy really differs to different local authorities. So not only have we got this kind of geographical element of the city region not faring as well on health, we also know that the differences between Trafford and Oldham, Trafford and Salford. We've got some other big challenges. When we come on to environmental sustainability, we'll be able to look at some of the impacts of things like air pollution on our residents and some of the great work that our team's doing. But it's just to kind of put the conversation that we're having today is that there is a greater focus, more so than ever, on health inequality in the city region. And there's a lot to go. So one of the things it'd be great to come back in 10 years' time and look at is the impact and the positive impact we've made on those statistics. I'm not going to focus too long because it's an entire kind of topic in itself, is the health inequalities of Greater Manchester. But I'm going to hand over to Howis to talk about kind of how better health works within the social responsibility theme. So Howis, over to you.
Thank you, Mags. So as we've said, under the theme of better health, there are 3 challenges. So we've got the global health challenges, which is very much about focusing on major global health challenges in the global south, and we'll talk a little bit about one of those later on. Then we also have the really local challenges, the civic health challenges, where we address those public health challenges through our students, addressing health inequities and sustainability, and really accelerating our research translation via organisations such as Health Innovation Manchester and the Pankhurst Institute. Thirdly, we have a whole theme of work all around patient and public involvement and engagement. And where we do that is that we actually embed PPIE to support research and teaching goals all around health impact in Greater Manchester. So could I have the next slide, please, Mags? Thank you. So better health. Some top line information for you here. So we have world leading research in biological, medical and health sciences with particular strengths in cancer, allied health professions, dentistry, nursing and pharmacy. And that was really brought out in the recent Research Excellence Framework of 2021. We also develop and deliver high quality education and training for health professionals and life scientists in partnership with the NHS and industry. And thirdly, we're the largest provider of healthcare graduates to the NHS in the northwest of England. Okay, so what I'm going to do now is to really bring that to life. I'm going to pass on to Rachel and Jasmine for our first case study. Thank you very much.
Thanks, Howis. Hi. I'm going to talk to you, if you go back one slide, Mags, thanks. It's okay. I'm going to talk to you about service learning, which is something I'm really passionate about and that I've done for my whole career. It's an approach to addressing some of these health inequalities through what a university, for example, and what we can offer. So it's a philosophy and it's a method and a pedagogy. So the philosophy is around the positive symbiotic engagement with the community, with students and the communities expected to benefit equally. In terms of a method, it's actually matching the community's needs with what the students need to learn on their course, doing it in a real world setting and addressing actual community needs. We've already got quite a number of programs which are really impressive already. So we've got things like law projects where the law students go out and they give legal advice to people that can't access free legal advice and they can't afford it. We've got pharmacy projects and medicine projects whereby the students go out to local schools. The schools have told us what they see their needs are for their school pupils. So for example, the medical one is that we've linked into the Healthy Schools Network, and they've told us that they've got an absolute crisis in the mental health for the young people in schools. They really need to have somebody that isn't their teachers delivering that, because they're with them all the time. So we've designed a program whereby our medical students, our student doctors, will go into those schools and talk about relaxation skills and mental health, and that maps exactly onto what our students have to learn on their course. There's a huge potential, and the vision is really to get every student in the university to be able to take part in one of these service learning projects as part of their course. We've already got an incredible volunteering programme, but we know that with cost of living crisis and other pressures, our students may be working other jobs and have other pressures. So we want to build in all the benefits of volunteering into the programme so that they can all access it, and we can really roll this out at scale. Huge numbers of benefits for everybody. For the students, they get a much more enriched curriculum. They're really practicing the skills that they're going to need in the workplace, and it's not just sort of governed courses like medicine or dentistry. Lots and lots of courses can do it. You can do a research project on your course which can be mapped to a community partner, and some of those research skills that our students and our literacy skills that our students have, the community partners, they just can't access it and they don't have the time and skills to do that. So it's a really lovely partnering. For the community, they get work done and skills that they wouldn't have access to. They can be incredible role models for students. So for example, say in some of the healthcare programs, you're often seeing people in patient mode and they seem like they've got, you know, they're not in the best. You're never in your best in a hospital bed. Whereas with this, they're actually seeing real people, what their skills are, what their lives are like, getting out there and understanding that. Breaking down that town and gown barrier that you can sometimes see and feel. And for the university, it's really building incredibly strong local partnerships, getting that working together for what the community can gain and deliver. It's just like a flagship activity for everybody, for the students and the university. I'm going to hand over to Jasmine because I think it's much easier to understand it with her talking through what she's done and what she's got from it. So Mags, if you could have the next slide, that would be amazing. Thanks.
Thank you for that, Rachel. So I would like to talk to you guys about some of the activities that I undertook last year when I was in my second year as part of the service learning initiative that the university offers. So I actually undertook two different pilot schemes. One is called the SDOP, so the Student Doctors Outreach Programme, which Rachel touched on lightly about how we go into schools. This was done virtually due to the situation at the time, and talk to younger students about mental health and ways to relax and how to manage their anxiety, which conferred a whole range of benefits. However, more specifically, what I'd like to focus on today was the second opportunity that I was offered, which is called CEPA, which stands for Community and Trustable Professional Activities. It's detailed on the slide here as early community access because that made it far more comprehensible for people not involved. And so what the CEPA programme involved was I got to spend a day in a local GP practice over in Cheadle, monitoring patients' blood pressures. Now, this is something that ordinarily would not be included in the curriculum as an experience to do out in the community. So we get taught how to measure blood pressures. We spend lots of time practicing it in a clinical environment with each other, because that's how we learn as students. And then we spend separately a lot of time talking to simulated patients. So these are actors who come in and help us practice our communication skills and our people skills as if they were in a GP clinic. However, in first and second years, the opportunities are very, very limited to get out and practice these skills. So through the early community access programme, what I was able to do was, after having received the training and being thoroughly assessed and made sure that I was competent, as well, I did some extra training as part of the CEPA programme just to prepare me for the experience, was I got to spend a day at this GP practice. And what I was doing there was I was just monitoring all the patients' blood pressures. So there was a diabetic review clinic going on, which meant all these diabetic patients had to come in and they all had to have their blood pressure checked. And initially I began doing this under supervision of a senior. And once she sort of had ensured that I was competent and safe to do so by myself, I was able to go off in a separate room and make sure patients' blood pressures were monitored before they'd go through and have the rest of their diabetic review completed. Now, this conferred a whole lot of benefits. Firstly, I'll talk about the benefits to myself. So at the time, I was the second year and I had never actually laid hands on a single patient. I'd had some virtual telephone consultations on my first GP exposure practice. But other than that, I had never actually seen face-to-face a real patient. So for me, this opportunity was absolutely wonderful. I got to put these skills that I'd been learning into practice. At first, there was, a little bit of nerves of, oh my gosh, what if I say the wrong thing? And what if I grabbed their hand wrong? But after about this first or second patient, that had completely gone. And I found that I was able to very, very naturally conduct those blood pressures. This conferred later benefits when it came to my examination. We had a blood pressure station in our OSCE at the end of the year, which is our practical exam. And I felt far more confident than my colleagues who had only ever practiced on each other in a very colloquial setting. And so for me, that felt very, very natural and I wasn't nervous at all. And I passed that station at excellent. Furthermore, in order to practice for this examination, as Rachel mentioned, being a student is very expensive and the current cost of living crisis is not something any of us are enjoying. But actually, some of my colleagues actually ended up going out and spending 15, 20, some even £30 purchasing their own SIG, so their own blood pressure cuffs, so they could practice the manual skill, which is obviously an added cost to students. And it's not something that everybody is able to do. So we had some people practicing or borrowing others, but I didn't feel the need to do this extra practice because I'd spent a day measuring a whole bunch of blood pressures. So that was the advantage to me. But furthermore, the thing about service learning, as Rachel mentioned, is that developing of a symbiotic relationship, showing benefits to both students and the community. And I was able to be of real help to that practice by really sort of helping get patients through more quickly, make it a more streamlined service, and just help out with the practice, to the point that I actually really recommended it to some of my other colleagues. So what we hope is to be able to include more of these within the curriculum, so that it's not something that students feel like they're missing out on, or that they don't all have the opportunity to do, but more importantly, that they all get a chance to do that. So overall, to summarise, the CEPA programme, the Community and Trustful Professional Activities, was of great benefit to both me and the community. It enhanced my learning to the point that now, when I'm in third year, we were released onto the wards and having the greatest times. But some of my colleagues were like, oh my gosh, I haven't done blood pressure since second year in that one session, and I haven't spoken to real patients. Whereas I was able to draw back on my experience towards the end of the year and flow far more naturally into a clinical placement. So overall, it was an incredible experience and something that I really hope we can incorporate in the curriculum for future students going forward. So I'd now like to pass on to Professor Snow to discuss the next part of the agenda. Stephanie, I think you're still on mute there, if you wouldn't mind unmuting.
Thank you. You'd have thought we'd all have learned after these years. But anyway, I think you're talking about your experience absolutely speaks to the value of patient and public involvement and engagement, and really creating these very close associations between our research and our teaching and the health outcomes of patients in our local communities and beyond. Within the Better Health theme, the PPIE work that we do is absolutely vital, because it's through that we can really translate the benefits of research and our knowledge to our communities through the different projects. And this morning, you've obviously heard about the work that Rachel and Lynn and Jasmine have been doing in service learning, and I'm going to be talking about our project on the NHS, and I know you'll be hearing about a global project sort of later. So Mags, if I can have the next slide, please. So Jane and I this morning are going to talk to you about the work that we've been doing together over the past 5 years. And that work has led to the creation of an oral history collection, Voices of Our National Health Service, which is now deposited at the British Library. It stands as one of the largest health-focused oral history collections in the world. And to the best of our knowledge, it is the only national collection of the experiences of the COVID-19 pandemic across one nation. So we began 5 years ago when in 2017 we got support from the National Lottery Heritage Fund to start creating the oral history collection, the history of the National Health Service, by recording the stories of patients, staff and communities across the UK. So we worked in 10 different localities, and we particularly wanted to capture voices which had been unheard. So particularly those of older generations, those who were then in their 80s and 90s, and communities who were not regularly engaged with this sort of historical work. Because the aim was to put on record the place of the National Health Service in our everyday life and the ways in which the story of the NHS is the story of all our lives in the UK since its creation in 1948. The impetus for the project, the real sort of push for doing it, really came out of my frustration as a historian. I worked on the history of post-war healthcare, and since 1948, whatever aspect you look at, the NHS is central to that. But actually, when it came to historical sources and to understanding what had happened and why it had happened, the voices of so many of the people who had made that history were missing. I mean, by and large, the voices on the record at that time were people like politicians, civil servants, clinical leaders, and they were generally white males. So that is why it felt so important to address the issue. And we used a volunteer model for the project. So in every locality, we recruited volunteers from all walks of life. They trained in oral history, and then they set out to homes, hospitals, community spaces, and many other venues to record stories from patients, staff, and the public. We had huge support from NHS organisations, charities and communities. They were really generous in giving us the space and some resources to enable the work. So by the time we got to March 2020, we'd captured over 800 interviews. We were planning a UK-wide tour with a little exhibition to really share what we've been doing across the country. But in March 2020, you all know what happened. The NHS became centre stage for the UK's response to the COVID-19 pandemic. It was the biggest health crisis since the NHS had launched in 1948. And we realised very quickly that we had a unique opportunity to capture the pandemic in real time. We had our volunteers, we had interviewees, we had lots of networks across NHS organisations and health-focused communities and charities. But I think the most important thing was that through our volunteers, we were able to do that immediate sounding out of people was this an appropriate response? Was it ethically responsible to ask to interview people when they might be working on the front line, when they might be shielding at home, and at a time of really high social anxiety? But we had a really resoundingly positive response. So after a real scramble to adopt our interviewing techniques from face-to-face to interviewing over the phone, we recorded our first COVID-focused interview 4 days after the first national lockdown in March 2020. Between then and June 2020, when that first national lockdown started to ease, we'd recorded over 600 interviews alone. We were then really lucky to get additional funding from the UKRI COVID urgency call through the Arts and Humanities Research Council in July to continue the work and partner with the British Library to create a national collection of COVID-focused testimonies. And the collection that we've been able to create has 2 unique features. First, because of the previous work that we'd done before the COVID pandemic, we have a baseline of evidence about the place of the NHS in everyday life over its 70 plus years. So we've got people's experiences of health and care, public meanings and memories of the NHS, and indeed comparisons with other health crises such as HIV and AIDS in the 1980s, or epidemics like Ebola and swine flu. those things mean that we can really contextualize the impact and effects of COVID in a really effective way. And there's obviously no way we could have anticipated this to have set it up as a planned research project. It was simply an immediate response to the urgency of a global pandemic. The second unique feature is that we were able to record ongoing series of interviews with people throughout the pandemic, which really captured their reflections on a week-to-week, month-by-month basis. And again, this has produced some really unique evidence about how memory processes work and about the relationship between individual and collective memory. But there's absolutely no way in which we could have done any of this without the skills and the networks that our volunteers bring to the project. So now I'm going to pass over to Jane Hampson, who will share her experiences with you. Jane.
Thank you, Stephanie, and thank you for inviting me to speak as a representative of the many volunteers that have been involved in this project. I've loved being part of this, helping people to record their lived experiences of working in the National Health Service and accessing NHS care over the entirety of its existence. And it feels so important to me to capture the emotional impact of those experiences, as how people feel is not generally documented in other data records. The human voice captures something unique and individual, and as listeners, we're able to empathise with the person's experiences. Throughout the pandemic, this project became an outlet for many people to be heard at what was a very difficult and challenging time in their working lives. And for us as volunteers, it was a really important way of helping and supporting people when we were unable to go and meet them. And for me personally, I was able to support my sister, who was working as a nurse during this very difficult time. And I couldn't actually go and see her to give her any emotional support. The project has an enormous reach and has included interviews that I've done as well with policy shapers, many different clinical staff, and a great diversity of people in non-clinical roles, which are often forgotten about when people think of the doctors and nurses in the NHS. And there are so many other people that work really hard and make an enormous and valued contribution. And it's created this hugely valuable resource. For me personally, this project has been a wonderful opportunity to learn new skills. And I've had the huge privilege of working with a highly professional and supportive team here at the university. As volunteers, we have felt that our contributions and involvement are valued, and we have seen how our input has contributed to shaping the project as it has evolved. Our well-being has always been a priority for the university team, and we appreciate the support. So thank you, Stephanie, and all the other people who've worked with you. It's been an enormous privilege to have had the opportunity to enable people to share their stories and to help build this incredible archive. I look forward to seeing the archive being accessed and made use of in the future. I'm grateful to everyone who has been so generous with their time in contributing their interviews, and to Stephanie for giving us the opportunity and for trusting us with such a central role in this project. Thank you, Stephanie.
Absolute pleasure, Jane. And it only is what it is because of people like Jane who've given everything to support and work with us. So now I'm going to pass back to Howis, please.
Thank you. Excuse me. Thank you, Stephanie. So you've heard about the local and national initiatives that are going on under the Better Health theme. And now we move on to global. And so we have an impact, the positive impact through education, research and students. For example, our students, we have a dedicated Manchester Global Health Student Society. And next we're going to move on to a case study. Professor Mahesh Nirmalan is actually out in Kenya today as we speak, and he's working on overseeing a project all around improving the health of Kenyan populations. And so he's asked me if we could actually show a video, which will be on the next slide, please, Mags. Thank you so much.
We are here in northern Uganda, one of the poorest deprived parts of the world. This region suffered 20-25 years of prolonged war, one of the most vicious and malicious forms of war where violence was rampant. People suffered extreme forms of physical, mental and psychosocial violence in this region.
I got incident in 2002 from Gulo in a place called Pecho. In August 28th, that is the month of which I lost my right leg.
The scale of disability in northern Uganda has been assessed by several NGOs during the time of insurgency, and it is estimated that over 1,000 people have been injured or living with a disability following the insurgency.
The project has three main arms. We want to determine what is the size of the problem, how many people need prosthetic limb services in northern Uganda. So in order to do that very well, we need to know where the people live. We had to seek help from experts in Manchester to do proper detailed mapping of this area.
A key part of our disability project is that we're actually wanting to deliver services to the people that need it out here in northern Uganda. And the only way we're going to be able to do that is to be able to give a robust estimate of exactly how many people we think are suffering with major limb loss in this area. So what we need to do is make sure everyone is on the map. We know who lives where throughout the region, so we can deliver the orthopaedic services that are required.
So there is a lot of morbidity out there which needs to be addressed properly. We wanted to set up an outreach service to access people who had lost limbs as a result of the war. And if productivity in this part of the world is not handled properly because people are disabled, it's not something that is desirable for Africa, that is not desirable for Uganda, and that is not desirable for the rest of the world.
It was on the 2nd of February 2005. I went for water. So on my way to the well, I stepped on a landmine. People ignored me. People left me. People isolated me. My own people, even my grandmother. Life was very difficult. My father lost hope in me. I really felt very bad because, of course, you cannot ignore your own child like that. And to gain back my trust on my father took me some time.
Disability as a result of war trauma is emotionally very, very close to me. We want to launch a program whereby we use culture and forum theatre as a way of engaging the public to change attitudes and long-term views of disability. So when I saw similar events being portrayed through the forum theatre, I was moved. I was moved to my core.
It's how other people treat you. That's what gives you, and that's what tells a story. We're in place of war, and we're creating a play based on the experiences that some of the guys with disabilities face in the community, in order to make the potential for them to take that into a community and address the issues of how people view people with disability. Right, so because of her disability, this guy's going, no, she needs that like everybody else wants.
I think this data has the capacity and ability to change community. I remember when we introduced this play to Amoro district, and people were admitting that sorry for what they have done already to us. And I think if we continue with it, many people who are suffering, just vulnerable in community at the grassroots, there will be change and many things will happen.
As you know, the world has got lots of conflict going on, and all these conflicts will leave with disability, and how we handle them has to be approached in a very logical way.
Things are really going on really well, and I'm really amazed. This is a project that it's now a new baby in our community, so I think people are really waiting to welcome this.
What has happened today, it's amazing. It's beyond my expectation. It has gone beyond, it's beyond, and I'm very grateful for it.
And so following on from that work, They are now conducting a quality of life survey for those in receipt of those artificial limbs. The survey will be done in collaboration with the University of Gulu and the University of York. Once this study has been completed, we expect that this outreach model will be the model of choice in all post-conflict settings to ensure better health for those affected. Thank you very much.
Thank you very much, Howis. So just to finish up, we can put the slides off. Thanks a lot, Megs. Just to say, I hope that's brought to life when we talk about our priority around better health for social responsibility and civic engagement. It's very easy to talk about facts and figures, but to hear stories firsthand, I just thought it was really inspiring to listen, first of all, to what Jasmine and Rachel told us about how medical students are doing things that have real benefit in our most local communities. And then to hear Stephanie and Jane talk about our contribution to the nation, this most cherished institution. I think we'd all agree with the NHS that we're born in, we often die in, and means so much at key moments of vulnerability in our lives, and how that was used, that project then, in a pandemic to capture the stories of the biggest pandemic there's been in around 100 years. And I think that's something that hopefully you can see the type of research we do in capturing those stories, and then taking that globally as well, just to see the scale of what we've done in a country far away from Manchester, but one where we have extremely close links. We have extremely close links in Uganda, in Tanzania, in Rwanda, and in Kenya. Manchester traditionally has had strong links, and we're looking to build on those in the coming years. And that was a wonderful project involving geographers where, without a postcode, if you're trying to find a mud hut in the middle of northern Uganda, there's no street name, there's no house name, but you can pin it on a map very cleverly. And this is what our geographers did. We used theatre practitioners through a spin-out project, a spin-out charity in place of war through our drama department, working then with medical colleagues like Mahesh in Harris's faculty, who have a commitment to undertaking and delivering in a high quality way some of those prosthetic limb pieces of work, which now the data we've got, it's to say it's life-changing is an underestimation, the difference we can make to people's lives in this part of the world. So hopefully that's brought things to life. What we like to do now, it's just coming up to 1:45, and we're going to go on probably for, we've got a good 10 or 12 minutes if we like for questions. It's really, please feel free to direct your questions at anybody who you've heard talk today, and I'm sure they'd be glad to try and answer that. So Colin, I notice you've got your hand up first of all. So Colin, please, over to you.
Thank you very much, Julian. I want to start by giving a real heartfelt thank you to all the presenters today. Inspiring stuff. I mean, it just really fills you with pride as to what Manchester's doing. And I thank the folk for the time they've taken to share that with the council. And it's just great. I've got a whole basket full of questions, but the one I will choose is for Rachel. And she mentioned the fact that service learning was a target for every student in Manchester, and I just wonder what processes we've got in place to try and make sure that sort of is. That sounds a real tough challenge. What processes have we got in place to try and make that happen?
Well, I'm not shy about taking on an enormous challenge. I think it's good to have big aspirations for this, and we start small and we just build on it. We have got a plan. The initial things are things around coming to talk to you about it, getting the literacy about what is service learning, so we understand what it is, what it isn't, how it's similar to volunteering but different. Get the case studies out there like with Jasmine, so that people at the university, people that are directing programs can go, oh yeah, that's what it is. Oh, I see how it works now. We're going to have a hub with lots of how-to guides. There's increasing expertise within the university about how to get things up and running, errors not to make again, learning from our own experience. That's the ambition of Raj, who's my other co-lead, and I, and we're going to slowly get there. That's my plan.
It's a great question, Colin, as well. If I may come in just to say, because I think we've created these roles. Rachel's just taken this up very recently, along with Raj, who can't be here today. And these are roles across the whole of the Faculty of Biology, Medicine and Health. and we're calling it co-leads for service learning. This is a new concept in the UK. If you go to a US university, they totally understand what service learning means. And the UK is one of the world's leaders in thinking about research impact. We even give 25% of what it means to be a good researcher. We measure it to do with the quality of the impact. We don't do that around teaching. We often think of teaching, in the case of Jasmine, a good outcome would be she'd go on to get a good graduate level job and she'd tell us she's satisfied with her learning. It takes no account of the contribution or the potential of that learning to have a positive impact on communities during the process of the learning. And this is easier in some subjects than others, I must say, and we're starting in biology, medicine and health because we've got some really good traction. Rachel's been doing this without calling it service learning for 20 years or so. So we know people have been doing this, but we need a language around it. You mentioned law students. We've got politics students who are looking at international politics and the situation of the refugee crisis and how do we politically manage these situations, working with local refugees as part of their learning. We've got life science students who are going to take water samples in canals around Manchester as a project to look at the cleanliness of water. We've got projects like this happening a lot, and what we need is a language around it, as Rachel says, and some leadership, and again, Rachel's providing that, and really make this more of a movement. So yeah, starting small, but we're starting from a tradition that I think we've already got in many programs in Manchester, and trying to share that practice around this. There's a brilliant question, Colin, and the more people can talk about this with pride, like Rachel and Jasmine were able to do, the better, because even, you know, if we're measured for teaching and learning on how satisfied our students are and how employable they are, that's how the government measures us. It definitely helps with that, but it does so much more. Those things that they don't choose to measure, but we think as a socially responsible institution, if our students can have that positive impact whilst they're learning, it's brilliant. So thanks, Colin. Would anyone like to make a comment or ask a question next after Colin, please? Anne, hi Anne.
Hi there. Thank you. That was absolutely fantastic, every single bit of it. Can I go back to the work around capturing experience through the Voices project and COVID, and ask what, if anything, has come out as a product at the end, which might be able to help us better manage the very next pandemic?
Thank you. I think that's a great question. That was one of the things that we were really keen to try and do as we were actually doing the collecting. So what we did during the sort of particularly intense period of COVID was to look for the public and political inquiries that were going on, and then use some of the testimonies that we've got to develop evidence and feed those through to the inquiries. And that was actually very successful, because we got our evidence used in the British Academy inquiry into the social impacts of COVID, and then we reported to the all-party parliamentary group on the coronavirus, and that was taken up in some of their reports. And then most recently, the Public Accounts Committee in the House of Commons